So you're a new parent. You bring your newborn baby home. Everything is great. The baby is eating well and all is well until we hit 6 weeks old and the baby starts crying. Screaming, high-pitched crying like there's something hurting. More than 3 hours a day, more than 3 days a week, just screeching, crying, and you're wondering, what is going on with my baby? If that's you, that's what we're going to talk about today, infant colic. Hello and welcome to my channel. I'm Dr. Lumfundi. Thank you for joining me today. Infant colic is something that affects a lot of infants, and one of the reasons why we see at least 1 or 2 newborn babies almost on a daily basis in clinic with infant colic. So today we're going to talk about what you can do at home to soothe your baby, especially when they're going through that phase. So why do babies at this age then have the colic? There is no known reason. All the research, there's just speculations about it. There's some people who say maybe it's that neuro-gut immuno connection that is going through during that phase. I've read reviews where they've talked about possibly like a 4th trimester where they're transitioning during that newborn phase from being in the womb for 9 months until that transitional period. It can be overstimulating and overwhelming for some kids, and then can lead to that screeching crying. Now, if that's your baby, you want to first of all make sure that there's nothing else going on with the baby. We make sure that there's no fever, there's no abnormalities, there's nothing else. So most of the babies who have the colic, they're still eating well, they're peeing and pooping well, and they're gaining weight. So if that's not the case, you may want your pediatrician to take a look and make sure that there's nothing else causing those symptoms for your infant. Now, today we're going to talk about those kids that we've looked at everything, we've examined the body, we've checked the diapers, we've checked the fingers and toes, make sure there's nothing wrapped in there or any other reason why they should be crying. Now, if we've ruled out any other medical condition or any other thing that may be causing the crying consistently, then we move on to the case of then how can we then take care of this baby that we know that is healthy and fine, but then going through this very stressful stage, and stressful for both the baby and both for the parent, because a lot of research is showing that parents who have kids or infants who have colic, they have a higher stress level and have an increased risk of maternal or postpartum depression, which rightfully so, because imagine your baby just crying every day for 3 hours, screeching like there's something wrong but we can't fix it. That will cause a lot of stress. So because of that, we're going to talk about how we can then take care of it, knowing that there may be a component of sensory or overstimulation, and knowing that it could lead to maternal depression. The first step I usually would tell parents is get the help you need. If you have another person in the household, a grandparent or someone that can help you, just hand over the baby. Make sure you're doing some self-care, whether it's just taking a nice long shower or a 30-minute walk, because you want to be able to be calm enough to help your baby calm down. That's the first thing. Now, as far as therapies, or what other things do we have available? The first thing is gripe water. Gripe water has been along for a very, very long time, and over the years the preparations or whatever is put in it has changed, and most commonly now we're seeing formulas that have fennel, chamomile, lemon balm, or ginger in it, all of those that are soothing in the stomach. And most of the patients I see, they do better with the gripe water that have a formulation that has any of the things I just listed. So gripe water I usually would recommend for kids, and based on all the studies, I've not had anybody who's had a side effect using gripe water. The other thing as far as what you can do for them is probiotics. Probiotics is another thing that has been researched, and they had a study where they compared probiotic to Mylicon, which is the most common one before, and the infants who were on probiotics did better than the Mylicon. So I have been also recommending a lot of probiotics, and the bacteria colony in the probiotics that is recommended or that has been proven to help is the Lactobacillus reuteri. So the most common brands I've seen that will have it 100 million colony forming units is the BioGaia brand. They have that particular strain of probiotics in it, and most parents would say that has worked for them their kids too. The other thing I recommend, whether it's breastfed kids or formula fed kids, is maybe changing the formula, or for the mother to change their diet or modify their diet. So if it's an exclusively breastfed kids, having the mom remove those highly allergenic things from their diet, most commonly like dairy products like cow's milk protein, soy, nuts, and those are the big ones. Some people have to remove including eggs and fish, but most commonly the dairy. We're removing that, and they've seen that the kids whose parents actually modify their diets that way, the kids do much better. And if it's a formula fed baby, going for the hydrolyzed formula options, what we have for that is like the Nutrimogen or Alimentum or any other new hydrolyzed option of the formula that is for colicky babies or for kids who are not able to really particularly digest the cow's milk protein. And so those are the main things that I do recommend, and those are the things that have proven to help. And then finally, helping the baby relax as far as the environment. If we're saying if there is a component of overstimulation, then encouraging the infant massages, white noise or soft music, taking the baby out for a stroll outside, especially when it's not too hot outside, making sure the skin is protected, of course. Car rides have helped too. So all of those things that are the movements that will help soothe. And sometimes it's just holding that baby on in front of you and doing the shushin or really gentle swinging movements, because the movements have proven to help. So with all of these strategies, whether it's gripe water, whether it's probiotics, or adjusting the diet, massaging, and environmental, hopefully that helps your baby where they're not crying every single day for hours, and that helps reduce the stress and help you enjoy that transition. So imagine if you have that newborn baby who's crying and they're now calm enough where you can actually enjoy that process, right? Because that time passes by really fast. The goal here is for you to enjoy and connect and bond with your baby. Now, thank you for listening. If you have a question, drop it in the comment box. I can't wait to see you next time. I'm Dr. Lum.